Thank you very much, and congratulations to Frank on this historic and amazing milestone meeting. On behalf of my co-investigators, I will give you an update on the GOR-TAG single-branch endograft for treatment of Zone 2 pathologies. These are my disclosures. This slide illustrates the procedure for placement of the GOR-TAG TBE device. The device consists of an aortic component with diameters ranging from 21 to 45. This device in Zone 2 has internal portals of 8 and 12 millimeters that accept side branch grafts ranging in size from 8 to 20 millimeters. The clinical studies to date include a feasibility study for Zone 2 aneurysms, which now has 5-year follow-up. They enrolled 31 patients at 6 sites, and a pivotal study of Zone 2 descending thoracic aneurysms and other thoracic pathologies at 34 sites, 84 patients with aneurysms. This group was used to support approval of this by the FDA in May 2022, and a non-statistical arm with dissection cohort of 132, and then isolated aneurysms, including traumatic transection. If we look at the 3 largest groups, the Zone 2 feasibility aneurysm, Zone 2 pivotal aneurysm, and Zone 2 pivotal dissection, you can see that the baseline demographics were similar between the trials. Of note, the dissection group was younger, more often male, and more commonly with hypertension, but had a lower frequency of coronary artery disease and chronic obstructive pulmonary disease. There was a similar risk profile between these 3 trials. If we look at core lab reported device events, including side branch loss of patency, aortic rupture, device migration, wire fracture, and aortic enlargement greater than 5 millimeters, you can see very low frequency of these events. If we look at core lab adjudicated endoleaks, there were type 1 and type 3 endoleaks. In the pivotal trial, there were 8. 3 of them were type 1. However, none of these resulted in either the feasibility or pivotal in aortic enlargement, and only 1 patient had a re-intervention required. Speaking of re-interventions, there was a low rate of re-interventions in the aneurysm cases. There were 2 in the feasibility through 5 years and 1 in the pivotal through 1 year. This is a case from the feasibility. You can see after initial placement of the Zone 2 device is not in the desired or optimal location, even though the core lab, or the lab at the study site and eventually the core lab did not demonstrate an endoleak, it was thought best, given the morphology of this appearance of the device, to go ahead and extend it into Zone 1, as you see here on the lower illustration. Switching now from aneurysms to dissection, looking at false lumen status through 1 year. Of note, the primary intimal tear was obliterated in all cases. If we look at the false lumen status over the treated segment, you can see that there was a partial thrombosis or complete thrombosis in all patients, with slight evolution to complete thrombosis between 6 and 12 months. 6 dissection subjects required re-intervention. All of these occurred in the 6-month window. There were 2 retrograde type A dissections. There were also 2 ascending aortic dissections, which at surgical observation were noted to be in the aortic root, non-contiguous with the proximal margin of the stent graft itself. One of these patients who underwent surgical repair of this non-contiguous type A dissection unfortunately died. If we look at now mortality in stroke through 1 year in pivotal and 5 years in the feasibility trial, you can see the all-cause mortality. Lesion-related mortality was 0 in the aneurysm group, 3 in the pivotal dissection group. And strokes were in the range of 5.3 to 8.3%. In conclusion, Zone 2 aneurysm data from the feasibility study showed low rates of device event through 5 years. Most of these events occurred by the 24-month time window. In the Zone 2 aneurysm data from the pivotal study also had a low rate of device events through 1 year, similar rates of lesion-related mortality and stroke between the trials, meaning both the feasibility and pivotal, and a loss of patency, aortic rupture, and aortic enlargement rates improved with the pivotal study. In that regard, re-intervention rates dropped from feasibility to pivotal from 6.5% to 1.2% in these 2 aneurysm studies. And all of these occurred before the 6-month time window. The TBE is FDA approved for Zone 2, and the Zone 0, Zone 1 indication submission is anticipated for next year. Thank you very much.